What a day it has been for all of us here discussing primary health care in this province and the ways we can make our system more efficient and more effective. I'm sure all of you in this room have felt the positive energy. The level of engagement and the thoughtful contributions truly have exceeded my expectations, and I feel we've turned the page and we're ready to start a new chapter in the reform of primary health care delivery in this province. But what comes next is really important. And what comes next is really up to all of us. And I say that sincerely. Your clear desire and willingness to work together is symbolic of how we will all collectively work together in the long term to effect real change in primary health care. And it can be done. And I want to challenge you to work with me. I want to challenge you to work with us. I want to challenge you to work together to drive the kind of change that I sincerely believe is possible. And I know from talking to many of you in the room that you believe it's possible too. Today you sat together united as colleagues, community groups, health professionals, and citizens. I challenge you all to continue to work together in this way to ensure that we don't lose sight of what was started here today. By working together, we are greater than the sum of our parts. I had the opportunity to float around the room today. I didn't get to every table. I had hoped to, but it's a big room and there was lots of discussion inside and outside the room. But I did get to hear a good sampling of the discussions. And I got to see how you've worked together to come up with some really good ideas, both simple ones and innovative ones. And a lot of these ideas really did resonate with me. A few of them are ideas that I heard across the province through the regional forums. A few of them were ideas that I've heard from some of you since I came into this portfolio. And many of them are the result of some of the collaboration that occurred at the tables today. I heard a lot of you discussing the need for interdisciplinary primary healthcare teams in our communities, and some great ideas of how we can make that happen. So I'm eager to see how we can start facilitating those teams, and I'd like to see us do it as soon as possible. But I need your help because it requires many of us to change. It requires not just regional health authorities or the Department of Health and Community Services to do things differently. It requires many of the people in this room to show leadership in helping us to do things differently as well. So I'm prepared to help lead that change, but I need others to help lead that change. And many of the people that can be a catalyst for driving that change are in this room today. Others suggested reforms that would see exciting community-based providers work more closely together through virtual networks and shared electronic records, an area which we have already begun to work on through the introduction of the electronic health record. But we're not where we need to be. We've made good progress, no doubt, and I applaud the work that's been done. But I need your help and I need your ideas to take us to where we truly need to be in those areas. Also high on the list of topics I overheard today was how we can tackle the ongoing problem of high provider turnover, particularly in many of the smaller communities and remote areas in our province. Some of the suggestions on how to address this problem may take some time, but I'm confident that working together we can make progress in this area. But again, I'm challenging you to work together and to work with us to try and drive the kind of progress that I really believe is possible. I think all of the suggestions that came up today have merit. I can guarantee you that our Primary Health Care Advisory Committee and the staff of the Department of Health and Community Services, working collaboratively with the Newfoundland Labrador Centre for Health Information, will be examining these suggestions closely to see how we might begin to implement them. And we want you to be part of this conversation. If you're not on the advisory committee, but you're passionate about this and you'd like to help us, then I personally want to hear from you, because there's a place for everybody in this conversation. If we're going to transform our primary health care system in this province, then it's going to take a group this size and many more to bring about the kind of change and momentum that's needed. Access to services was a hot topic here today. We heard delegates telling their own stories and making some suggestions as to how we could improve access for residents to primary health care services. While I think we all agree that we face challenges within our current primary health care system, we have a solid base to move forward from. Our province is fortunate to have strong and committed health care professionals. We have excellent providers, active regional health authority boards and leadership teams, and dedicated staff within the department, within the regional health authorities, and across government. Although our goal here today was to focus on finding solutions to the challenges that we face, the vast majority of citizens' experiences with primary health care are positive, and we have high levels of patient satisfaction. It goes without saying that many of you highlighted competing priorities. So as we move forward, it's going to be critical that we enact changes that will have the biggest impact on health for the largest number of citizens. While there's certainly a lot we can do to improve primary healthcare services and supports, we need to consider new upstream approaches that encompass the social determinants of health, which include the conditions under which people are born, grow, live, work, and age. I really believe today's summit, which focused on primary health care rather than acute care and other downstream aspects of our healthcare system, was a step in the right direction. And as a government, we need to start thinking more of health as a state of complete physical, mental, and social well-being, and not merely the absence of sickness or disease. One of the things that really struck me today was Dr. Miley's presentation, which re-emphasized that we agree on the importance of incorporating health into all of our policies through the exploration of processes to determine the health impact of our policy decisions. It is through these type of changes, rather than increased budgets, that we will begin to see tangible and sustainable results that will have a lasting impact on our healthcare system and our citizens. There's much work to do, and I'm sincerely, again, inviting you to be part of that work as we move forward. I'd like to thank Premier Davis for being with us all day today, and I'd like to thank him for his leadership and vision in this area. One of the first things he said to me when I was appointed as Minister of Health, which in all seriousness is a huge honor and a responsibility I take to heart and take very seriously. He said, I want you to deliver on the commitment I made to hold a health summit within 120 days. And it's not just about listening to concerns, because we hear that every day. We hear, all you have to do is turn on the radio shows to hear concerns people have about things that are happening in our community, which sometimes relate to healthcare. It's about not just listening. Well, listening is important, but it's about bringing the right people together to try and come up with solutions. And I really believe, Premier, that we're on a track to do that, and we've done a lot of that today. So I want to thank you for your support in making that happen. I want to thank members of the House of Assembly. We have a great representation from Cabinet and our own caucus, but we also have members of the opposition parties here today as well, which I think is critically important. So I want to thank all of the elected officials in the room for being here. I'd like to thank our presenters today, those that were with us virtually and those that made it in person. And I also want to thank the volunteers that helped contribute to today's effort. I want to thank the amazing staff of the Department of Health and Community Services. There have been people working on this project for weeks and weeks and weeks, traveling the province to run regional forums, consolidating all of the input, making sure that today ran without a hitch. It's an impressive team, and I'm very grateful for all of their work. And likewise, I'm very grateful for the work of the outstanding team at the Office of Public Engagement, who have been a partner with us throughout the entire process, through the regional forums, and here today. So as the Minister also responsible for that office, I want to say a sincere thank you to the OPE team as well. Yeah, sure, thank you. I also want to thank those in other parts of government that are helping out today. We have facilitators and note takers and others at every table in the room and in the hallways and elsewhere who've contributed to the success. So I think having just about every government department represented in the room today speaks to the possibilities that we really can affect change. So thank you to all of you, and thank you to thank you for all of you who have attended today. We have many, many people in the room who work in healthcare. And as your minister, I want to thank you for the amazing work you do every day on behalf of the people of this province. Your passion and your dedication and your commitment and your professionalism is inspiring. And as I said earlier, the vast majority of contact that people have with healthcare providers in our healthcare system is positive. But that's not what you hear about every day on the radio shows and elsewhere. So I want to salute you for the amazing work that you do. And while we have challenges that we undoubtedly have to work together to overcome, you should be very proud of the work that you do each and every day for the people of this province. And I want to thank you all for spending the full day. It's not easy. You're all busy people with busy lives. We have many citizens here as well who don't work in healthcare, and many people inside and outside healthcare who've traveled large distances to get here. I want to thank you for taking the time to participate and for making today's event possible. Your contributions today will form the foundation of a primary healthcare framework, which will guide this province into the future. So what next? It truly is up to all of us. And I really do want your input. My challenge to you is very sincere. Let's work together to advance primary health care. Let's test some new models that could really transform how we deliver services in every corner of this province. The solutions are in this room. They've been talked about at various tables around this room all day long. So we just need to figure out how we make it happen. We do have finite resources. So how can we break down silos? How can we tear down some of the barriers that exist? How can each of us, in whatever role we play in the healthcare system, drive the kind of change that most of us, I think, agree is needed? So I sincerely thank you all once again. I hope you travel safely, whether you're going across town or whether you're traveling to the far north of our province. In fact, I was talking to one of the delegates from Western Labrador yesterday. He sent me a note to say, hey, we've arrived. And I said, great, glad you made it safely. Apparently, it's tough to get here from Toronto, but you can get here from Labrador, no trouble. And he said, yeah, we brought some of the cold weather with us just because we thought you might like that. So I'm asking those of you that are traveling north to take it back with you if you wouldn't mind. That would be greatly appreciated. But thank you for visiting the tropical island. We love it when you can come spend some time with us. Thanks so much, folks. I really do want to hear from you. I hope this is the beginning of the conversation. There's a lot of work to do. But if we pull together, I really believe we can drive the kind of change that's desperately needed. And I assure you of my personal commitment to, and I can assure you of government's commitment, as you'll hear from the Premier in a moment, to working with you to make that happen.